Have you ever stopped to think about how your body actually creates blood? It's this non-stop, microscopic manufacturing marvel happening inside you right now. But what happens when that system breaks down? Well, today, we're diving into the pretty incredible world of hemopoietic agents. These are drugs designed to step in and get our internal factory back up and running. And just to start, let's talk about the sheer scale of this operation.
Okay, get this. 2.4 million. That is the number of new red blood cells an average, healthy human body produces every single second. It's just an absolutely staggering rate of production, and it's essential for carrying oxygen to, well, every single part of you.
But of course, things can go wrong. Conditions like chronic kidney disease, certain cancers, or even the treatments for those diseases can really throw a wrench in the works. And that's exactly where these hemopoietic agents come into play. They're like the medical reinforcements we call in to get production humming along again.
To really wrap our heads around how these drugs work, let's think of our bone marrow as this highly sophisticated factory. It's got different assembly lines, right? One for red blood cells, another for white blood cells, another for platelets. So on our little tour today, we're going to see exactly how modern medicine can interact with this factory, boosting production where it's needed most.
First up, let's check out the assembly line for red blood cells. These are the oxygen couriers of our body. When their numbers drop, you get a condition called anemia, and that's why you feel so weak and tired. So how do we tell the factory to make more? Simple. You send in a supervisor.
And that supervisor is a hormone called erythropoietin, or EPO for short. It's the body's own natural signal. It's the official production order that tells the bone marrow to kick that red blood cell assembly line into high gear. The drugs we're talking about? They're basically just man-made versions of this very hormone, designed to deliver that exact same message.
And you might be surprised how widely they're used. I mean, these agents are a total lifeline for patients whose kidneys, the body's natural EPO producers, are failing. They're also crucial for counteracting the damage that chemotherapy can do to bone marrow. They can even be used to help a patient bank their own blood before a big surgery.
Now, we have a couple of different supervisors we can send in. And as you can see, the main difference, at least from a patient's perspective, is the half-life. Darbepoetin is the longer-lasting one, and that translates directly to fewer injections. For someone managing a chronic condition, going from multiple shots a week down to just one, that is a massive, massive improvement in their quality of life.
But, and this is a really big but, you can't just crank production up to 11 and leave it there. Overproducing red blood cells can actually thicken the blood too much, and that leads to some really serious risks, like high blood pressure, blood clots, you name it. So the goal isn't even to get back to a normal level. The goal is to find the absolute lowest dose that keeps the patient from needing a blood transfusion. It's a really delicate balancing act. Okay, so we've sent the production orders down to the factory floor, but what happens if the factory doesn't have the parts it needs? A production order is pretty useless if the supply shelves are bare, so let's head over to the supply room.
You can have the best factory supervisors in the world, but if the assembly line runs out of core components, production just stops. For red blood cells, two of the absolute most vital raw materials are vitamin B12 and folic acid. Without them, the factory simply can't build healthy, effective cells.
And this is where getting the diagnosis right is absolutely critical. You have to know which part you're missing. See, both of these deficiencies lead to a similar kind of anemia, where the body makes these big, goofy, immature red blood cells. But here is the crucial difference. B12 deficiency also causes nerve damage. And if you mistakenly treat it with only folic acid, you might fix the anemia on the blood test, but you're just masking the ongoing and potentially permanent damage happening to the nervous system.
So how does that happen? Well, think of vitamin B12 as a specialized worker in the factory responsible for, let's say, waste disposal. Without B12, certain fatty acids, a kind of cellular waste product, start to build up. This toxic buildup starts to eat away at the protective insulation around our nerves, causing it to break down. Only replacing the B12 can get that worker back on the job and stop the damage.
All right, we've restocked the red blood cell line. Now let's shift gears and turn our attention to another critical part of our factory, the unit that produces our immune system's frontline soldiers, the white blood cells.
The signals for this production line are called colony-stimulating factors, or CSFs. You can think of these as the factory's emergency alarm system. When they get activated, they send an urgent message to the bone marrow that basically says, "We are under attack. Produce and release more defenders right now." Specifically, they're boosting neutrophils, which are the body's first responders to bacterial infections.
And their timing is everything. Chemotherapy is designed to kill rapidly dividing cells, which is great for cancer, but it also takes out the cells in our bone marrow factory. This leaves patients with dangerously low white blood cell counts, a condition called neutropenia. CSFs are used to shorten this period of vulnerability, helping patients rebuild their defenses and fight off what could be deadly infections.
Now, these are powerful agents, and they come with some serious warnings. A really key one to remember is that this rapid increase in white blood cell production can cause the spleen to get enlarged, and in rare cases, it can actually rupture. That's why patients are always told to immediately report any new pain in their upper left abdomen or even their left shoulder. That can be a telltale sign that something's wrong with the spleen.
So far, we've talked about increasing the quantity of cells, but what if the problem isn't with the number, but with the quality of the cells being produced? Let's look at a pretty special agent that helps retool the red blood cells themselves.
This agent is called hydroxyurea. It is a cornerstone therapy for patients with sickle cell disease. That's a genetic condition where red blood cells are misshapen, they're sickle-shaped, which causes them to get stuck in tiny blood vessels. And that leads to these episodes of just excruciating pain called crises.
The way hydroxyurea works is it's fascinating. It essentially tricks the bone marrow factory into switching back to making a type of hemoglobin we all made as fetuses. It's called fetal hemoglobin, or HbF. This HbF gets into the new red blood cells, and it physically gets in the way of the sickling process. It helps the cells stay rounder and more flexible so they can slide through blood vessels without causing those painful blockages.
So we've sent in supervisors, we've restocked the supply closet, and we've even retooled an entire assembly line. But as you know, no factory can run without a really robust quality control department. And using these powerful agents requires constant, careful monitoring.
This checklist right here, this is basically our factory's quality control. We're constantly checking hemoglobin during EPO therapy to avoid that dangerous blood thickening. We're checking vitamin levels to make sure the supply room is actually restocked. And with CSFs, we're tracking our army of white blood cells and listening for any warning signs like that specific shoulder pain. It's this constant process of making sure these powerful tools are helping, not harming.
And that brings us to a final thought. We've seen how EPO can be a life-saving drug for a patient with kidney failure, but that exact same ability to boost red blood cells has made it one of the most notorious performance-enhancing drugs in sports. It's a powerful reminder that the line between therapy and enhancement can be incredibly fine. When we learn to control our body's most fundamental factories, we're forced to ask a question that goes way beyond medicine. What does it really mean to be well, and where exactly do we draw the line?